Hello everyone. Today our topic of discussion is the role of albumin in the body. Have you ever wondered why patients with liver disease, kidney disease or sepsis develop swelling? The answer often lies in a single protein called albumin. In this video, we will break down what albumin is, where it's made, what it does in the body and why its level rise or fall in the disease using a simple diagram. Albumin is the most abundant protein in the human blood, yet it's one of the most misunderstood. By the end of this video, you will clearly understand albumin production, distribution, functions, and causes of low albumin in a way that's easy to remember. What is albumin? Albumin is the most abundant protein in your blood. It's mainly made by the liver and circulates throughout the bloodstream. Let's look at this diagram to understand albumin production, transport, and breakdown. So if we look at this image, let's look at the liver. Liver is the main site where albumin is produced. The healthy liver normally produce about 10 to 15 gram of albumin per day. And you can see that the production of albumin is increased by hyperthyroidism, insulin, and cortisol. Sometimes pregnancy also increases the production of albumin. What causes the decreased albumin level? You can see here severe inflammation, sepsis, and chronic kidney disease can decrease the albumin level. Now, once the albumin is produced by the liver, you can see that it enters into the bloodstream. And in the bloodstream, 40% of the albumin stays in the plasma and 40% enters into the interstitial space. And this exchange between plasma and the interstitial space happen throughout the day depending on the capillary permeability. Now, once it is in the bloodstream or in the plasma, it helps to maintain the blood pressure because albumin attracts the water towards itself and maintain the blood pressure. And you can see that it is a transport protein. And once it is in the plasma, it helps to transport bilirubin, fatty acid, hormones, and calcium. And it also helps to maintain the blood pressure of the body. Now, how does it break down? Albumin is break down by the cells of the reticular endothelial system. It is break down by the liver, by the spleen, and by the muscles. So this is albumin production, transport, and breakdown. Albumin is also responsible for the transport of drug also. Different drugs we take, albumin help to transport those drugs also. Next is what are the causes of hypoalbuminemia? What are the causes of low albumin? So number four, the first cause is decreased albumin production. So albumin is not produced. So let's say if there is any kind of liver abnormalities like liver cirrhosis, chronic hepatitis B or C, fatty liver disease or liver cancer, acute liver failure, so liver will not produce albumin. So now let's say liver is producing albumin but patient is not eating enough protein and is malnourished, or the gut is not absorbing albumin. Malabsorption can also cause decreased albumin. Or if there is sepsis or severe inflammation in the body, that will also decrease albumin production. Second is the albumin is producing normally, but there is increased loss of albumin. So albumin can be lost from the kidney if there is a kidney disease like nephrotic syndrome, nephritic syndrome, glomerulonephritis, diabetic kidney disease. That can result in loss of albumin. The albumin can be lost in the gut. If there is a skin burn, that can also result in loss of albumin. And sometime if there is a chronic liver disease that can result in ascites or pleural effusion, so albumin will be lost into third spaces. Third main cause is dilutional causes. So in our hospital, if the albumin is normal, but if you overhydrate your patient, that will result in low albumin level. In patient with heart failure, there will be volume overload, which will result in decreased albumin concentration, and the same thing will happen in pregnancy also. Fourth main cause is the disease related causes. If someone has severe sepsis, severe inflammation in the body, that will decrease albumin, sepsis, inflammation. And sometime when the albumin is low, the surgery can be delayed because that will delay the wound healing also. And then there are some metabolic causes like hypothyroidism, uncontrolled diabetes, or Cushing syndrome, which can result in decreased albumin. Now, what are the main signs and symptoms which you will see if your patient has low albumin level? So, albumin is responsible for maintaining the blood pressure. So, your patient can develop edema, they can have ascites, pleural effusion, and they can sometimes have puffiness around the eyes. Albumin is responsible for building up of muscles also. Your patient will feel fatigue, tired, exhausted. They will not be able to perform normal activities. Your patient with low albumin, they can have poor wound healing. So if they have a surgical cut, it will be slow to heal. These patients can have loss of appetite, they can have nausea or diarrhea. Because the albumin is responsible for maintaining blood pressure, they can have low blood pressure, which can cause dizziness, lightheadedness. They can have pleural effusion, which can result in shortness of breath. Because albumin is responsible for transport of nutrients, so your patient can have dry hair, dry skin, dry nails. These patients can have jaundice because the liver will be affected. So depending on the severity of the level of the albumin, your patient can have different symptoms. The normal albumin level should be between 3.5 to 5.5 gram per deciliter, and if the albumin level is less than 2, the mortality is very high and they will have severe symptoms. So, what is our clinical takeaway from this presentation? Albumin may be small in size, but it plays a massive role in human physiology. Albumin is not just a lab value, it's a reflection of liver function, inflammation, nutrition, and overall health. So, take care. Have a nice day. Thank you.